Hello, welcome to AI Medical School. Today we are going to talk about diabetes. First, let's talk about glucose homeostasis to hypoglycemia. Glucose homeostasis is maintained by a complex neurohormonal system which modulates peripheral glucose uptake, hepatic glucose production, and exogenous glucose utilization following food ingestion. This allows the maintenance of plasma glucose concentrations within the normal range, with average values of around 90 mg per deciliters throughout a 24-hour period, postprandial concentration below 140 mg per deciliters, and minimal values, such as those after moderate fasting or exercise, above 55 mg per deciliters. Hormones implicated in glucose regulation include insulin, glucagon, amylin, glucagon-like peptide 1, glucose-dependent insulinotropic peptide, epinephrine, cortisol, and growth hormone. These hormones act on several target tissues, including muscle, liver, adipocyte, and brain to regulate glucose levels. Insulin is a key glucoregulatory hormone produced by pancreatic beta cells, whose levels are low during the fasting state, whereas they increase during the postprandial phase. When insulin stimulates the utilization of dietary glucose by peripheral tissues, and in the meantime represses hepatic glucose production. Another important hormone regulating glucose metabolism is glucagon, produced by pancreatic alpha cells during fasting conditions, when it induces hepatic glucose production through the activation of glycogenolysis, and, with more prolonged fasting, also stimulation of gluconeogenesis. A dysregulation in the mechanisms implicated in glucose homeostasis can cause acute or chronic hypoglycemia. Decreased/absent insulin production and/or reduced insulin sensitivity are important contributing factors to the development of hypoglycemia, and they represent the underlying abnormalities of diabetes. Along with a decreased or absent insulin secretion, diabetes is also characterized by impaired glucagon production, which can predispose to the risk of hypoglycemia in these patients. However, there is also extensive evidence that in patients with diabetes, hypoglycemia is often associated with hypoglucagonemia. And now, let's talk about diabetes mellitus type 1. Diabetes mellitus type 1 is a form of diabetes mellitus in which not enough insulin is produced. This results in high blood sugar levels in the body. The cause of type 1 diabetes is unknown. However, it is believed to involve a combination of genetic and environmental factors. Risk factors include having a family member with the condition. The underlying mechanism involves an autoimmune destruction of the insulin-producing beta cells in the pancreas. Diabetes is diagnosed by testing the level of sugar or A1C in the blood. Type 1 diabetes can be distinguished from type 2 by testing for the presence of autoantibodies. And now, the sign and symptoms of diabetes mellitus type 1. The classical symptoms of type 1 diabetes include polyuria, polydipsia, dry mouth, polyphagia, fatigue, and weight loss. Many type 1 diabetics are diagnosed when they present with diabetic ketoacidosis. The signs and symptoms of diabetic ketoacidosis include dry skin, rapid deep breathing, drowsiness, increased thirst, frequent urination, abdominal pain, and vomiting. About 12% of people with type 1 diabetes have clinical depression. And now, diabetes mellitus type 2. Diabetes mellitus type 2 is a long-term metabolic disorder that is characterized by high blood sugar, insulin resistance, and relative lack of insulin. Type 2 diabetes primarily occurs as a result of obesity and lack of exercise. Some people are more genetically at risk than others. Type 2 diabetes makes up about 90% of cases of diabetes, with the other 10% due primarily to diabetes mellitus type 1 and gestational diabetes. In diabetes mellitus type 1 there is a lower total level of insulin to control blood glucose, due to an autoimmune-induced loss of insulin-producing beta cells in the pancreas. And sign and symptoms of diabetes mellitus type 2. The classic symptoms of diabetes are polyuria, polydipsia, polyphagia, and weight loss. Other symptoms that are commonly present at diagnosis include a history of blurred vision, itchiness, peripheral neuropathy, recurrent vaginal infections, and fatigue. Many people, however, have no symptoms during the first few years and are diagnosed on routine testing. A small number of people with type 2 diabetes mellitus can develop a hyperosmolar hypoglycemic state, a condition of very high blood sugar associated with a decreased level of consciousness and low blood pressure. Thanks for watching. And don't forget to subscribe to our channel.